Good afternoon. My name is Linda Goller-Blount, and I'm the President and CEO of the Black Women's Health Imperative. And I'm excited to welcome you to another episode of Black and Well TV. For almost 37 years, the Black Women's Health Imperative has focused on improving the physical, emotional, and financial health of Black women through evidence-based programs, centering Black women in the development of policies at the national and state level, and by providing resources and information to help the everyday Black woman make the best decisions she can for her health and wellness. As our nation and our world navigate an ever-growing global pandemic, we are here to provide Black women with information to protect themselves and their families, but also with the hope and support that they need to just breathe. I'm excited to welcome three dynamic speakers today as we discuss the role of underlying conditions in COVID-19 and how these conditions relate to our risk of being infected, how we experience the disease, and to higher mortality rates among Black patients. While COVID-19 continues to impact communities across the country, we now have data that shows that the rates of infection and deaths among Blacks and Latinos are significantly higher than for their white counterparts. Recently published data suggests that Black Americans get COVID-19 at 2 to 3 times the rate of white Americans. Nationwide, the case fatality rate is just over 5%, but for Blacks, it's approaching 8%. We know that much of the mortality we see in Black COVID-19 patients is due to underlying chronic disease conditions, what we call comorbidities. Of course, one might ask, why are there such high rates of underlying disease conditions in the first place? Some of the narrative attributes these rates to poor lifestyle choices, but it's impossible to talk about underlying conditions without acknowledging the role that social determinants of health play. Lack of access to quality care and health insurance, low wages or inadequate employment, lack of affordable, healthy food options, and provider bias are just a few of the structural inequities that Black and brown people face every day. Inequities born out of generations of racial and ethnic discrimination. Let's take a deeper dive into these issues with our guests. Our first guest is Dr. W. Scott Metcalf. Dr. Metcalf is a board-certified family physician, a graduate of Michigan State and Wayne State Universities, and has been in practice for over 20 years, first in Detroit and now in Atlanta. He and I are going to talk a little bit about preventive medicine and chronic disease. Then we'll hear from Paula Green-Smith. Paula is the Chief Training Officer at the Black Women's Health Imperative, and we're so thankful that Paula has made a full recovery from COVID-19. She's going to share some of her personal experiences with us. And toward the bottom of the hour, I'll speak with Mrs. Michelle Lawrence Jawanda, a true powerhouse in the DC area who heads U.S. Strategic Engagement and Public Policy Partnerships at Google. And like many of us, she's working hard to manage her career, her health, and her family from home. So this is designed to be an interactive experience. I just want to let you know that. We'll be looking at your questions. Please use the Ask a Question function located at the bottom of your screen or the chat function to the right of the screen and send us any questions you may have, and we'll get to as many as we can. But for now, let's welcome Dr. Metcalf. How are you?
I'm good. I'm well. How are you?
I'm doing okay. You're faring all right through all of this COVID-19 pandemic?
Oh, doing the best that we can. Thank you for asking.
So have you treated any COVID-19 patients?
Well, with doing urgent care or urgent visits for patients, I have came across a lot of patients that were non-A, non-B who presented with flu symptoms over the last few months. And up until recently, when the test first now became available. So at those times, we don't know whether or not we were actually testing patients who were COVID positive because we didn't have those tests at that time. But I highly suspect that, there's a possibility.
Do you have sufficient tests and PPEs right now?
Well, currently, there is a shortage of PPEs and the tests all over the nation, as you know. Now in my practice, my wife and I do preventive medicine, and we're building a practice currently. So we don't test specifically for COVID, but just going on the resources that are available and from the reports, we know that we're still at a shortage of PPEs, even for health professionals, and not to mention the general public.
Yeah. So from what we currently know about COVID-19, we're hearing a lot about underlying conditions, these comorbidities, as being responsible for the high rates that we're seeing in the Black and Brown community. Would you talk for a little bit about what it is about these underlying conditions that poses this risk, that causes this to happen, and in fact makes the disease more severe?
Yeah, that's an excellent question for you to ask, because we can think of it like this. Think of a person that's getting ready for elective surgery or just a surgery that's recommended by the physician. If the patient is completely healthy with no medical problems, they're typically cleared to go under anesthesia because we feel that their heart and their lungs and their organs are strong enough to handle being under. Now, when you think about patients that have uncontrolled hypertension, which means they may have damage to their heart, they may have congestive heart failure, which means your heart is a pump. So if their heart is not functioning right, or that pump is not circulating the blood throughout their body correctly or efficiently, if they have an inefficient pump, they have more problems during surgery or being under anesthesia. Same thing with people with underlying lung problems, sarcoidosis, asthma, emphysema. They have more risk of having some type of lung complication due to the surgery. And the list goes on and on. People with chronic kidney disease due to hypertension or diabetes, they may have circulatory problems due to their comorbid conditions when they go under anesthesia. So this, when we go on to being exposed to COVID-19, now, anyone that's exposed to COVID-19 will catch COVID-19. So no matter what you're taking, no matter what elderberry, all the brands that we've been hearing about, no matter what you're taking, if you come in close contact with someone and you're close enough to be exposed to COVID-19, you're going to contract COVID-19. Now, the way that your body reacts to it is kind of like the surgery when we talk about. If you have comorbid conditions that decrease your ability to heal, your ability to fight off an infection, like a lot of immune disorders. So it's not really having the disorder, it's saying having an uncontrolled condition. So someone with lupus, their immune system is not low, is that they are on medications that suppresses the immune system. Their immune system is actually overactive, which means that's why it starts attacking the body. Any of these conditions that attack the body, Crohn's, they are because your autoimmune system is overactive. And so you're placed on medication, steroids and anti-suppressant drugs that suppress your immune system, and therefore they decrease your ability to fight infections.
And when we think of COVID-19, we typically think respiratory disease, but our lungs are in fact not the only organs that are attacked by this virus, are they?
Correct. And a study out of Cambridge just came out today, and this is going to be breaking news for everyone. So far, they've isolated 3 different strains of COVID-19. They have an A, a B, and a C. This was just released from Cambridge scientists today. The most common one right now in the US and New York is strain B. And we don't know why this is deviated from the initial Wuhan or the strain that was A that was out of China, but they have an A and a B and a C strain that has been released that they determined are different. And that's why we don't know which strain someone is exposed to. We can say, okay, well, New York, the most common strain right now is B, and that seems to be the most virulent or deadly strain. We don't know how it mutated, or if it was, if it's a mutation of the initial, or if it's a different strain outright.
Altogether.
Correct.
So as we think about these underlying conditions, I mentioned earlier social determinants of health that need to be factored in. What is it that providers can do in partnership with their patients that might look at the social determinants of health and help their patients? As you said, you can't resist the infection necessarily. If you're exposed, you'll be infected, but to the best of their ability, minimize the disease that they experience.
Right. And when you go with that, you go back to things that your parents or teachers would tell you, that prior preparation prevents poor performance, or as we say, an ounce of prevention is worth more than a pound of cure. So we got to go to prevention and preventative medicine. And that's what we stress in our practice that we're building right now is preventative medicine, which means lifestyle medicine. You have the choice to be healthy. Just because an illness is prevalent in your family does not mean, unless it's a genetic dominant illness, it does not mean that you have to contract that illness. So if diabetes type 2 is prevalent in your family, it's just prevalent in your family due to unfortunate circumstances or choices. And those circumstances can be your lifestyle, the overeating, the lack of exercise, the eating of the wrong foods, the lack of ability to eat the right foods, because not everyone can go to a fresh farmer's produce and get fresh vegetables, pesticide free. Some people may think they're doing great by eating vegetables out of a can, which may have a high amount of sodium. So we know that there is a socioeconomic determinant as far as disparities in health. We know that access, as physicians, we need to make ourselves more available to the public, because being healthy is something that's free. It's free. This is free medicine. If you get out and walk this 30 minutes a day, if you don't eat, excessive amounts of food or high caloric intake with, sugar, fats, all those things will play a part in promoting a good health. And then we have to realize our minds as well. So you have to be in a healthy mind state. Mental illness is a disease as well. So we have to have, we stress with our patients that you have to have a healthy mindset, because if you're not getting the right amount of sleep, if you are not thinking correctly, if you're suffering from chronic fatigue, all those things can play a part in you being less able to fight off illnesses, to fight off regular common, the people that suffer from, if it takes someone 3 days to get over this, it may take you 3 weeks to get over it.
Longer. Right. Well, thank you for that. That's actually a perfect segue, Dr. Metcalf, into Paula Green. I want you to stand by because we're going to bring you back for some questions. But you're talking about access to fresh fruits and vegetables, and even sleep is really important. Paula Green Smith is our Chief Training Officer for the Black Women's Health Imperative, and we're fortunate to have her here. One of the things that Paula does is she runs a lifestyle program. The Black Women's Health Imperative offers the National Diabetes Prevention Program. So Paula, you spend a little bit of time talking about healthy eating and active living and emotional wellness, getting enough sleep. But you also talk about this to people who, as Dr. Metcalf said, may not be able to go to Whole Foods and buy fresh fruits and vegetables for their families. So first, let me start with, how are you? How are you feeling? And would you, just tell us a little bit about what your experience was with COVID-19?
Thank you. Thank you, Linda. I am great. Thank God I'm great. I feel so blessed because we have gotten through this. My husband and I both had it. And it's really interesting because the more I hear from others that have had it, the more accounts I hear, especially Chris Cuomo on CNN. When I heard his account kind of mirrored ours. Now, as I've heard so many accounts, I've learned of all these different symptoms that we didn't even know to recognize or to look for, because we were stricken with this about in mid-March. But now that I know the symptoms, I am pretty certain that I started coming down with it back with dizziness in February, like mid-February. So because it wasn't debilitating and I, do what I do, I was out doing my thing, working, saying I'm going to contact the doctor if it doesn't stop. I kept burning the candle at both ends, and I believe my resistance got down, and that's when it knocked me out. So from a Monday evening where I felt just a slight dizziness to Tuesday morning where I was weak, had body chills, excruciating generalized pain, and a temp of 101.8. That's what made me go to the hospital.
Wow. And when you went, were you tested immediately?
Yes, we were so blessed because at that time, Beaumont Hospital had a test. Now, we were in contact with our doctor who said immediately, just go to Beaumont. We went out to Beaumont. Beaumont took us in, ran a flu test first. We tested negative for the flu. Then they did all the respiratory work. And then they did the COVID test. And we
So
were told
they didn't start with COVID-19. They
No.
started with the flu. Yeah.
Right.
Yeah.
And they ruled out the flu. And then we were told that we would get the results back within 24 to 48 hours, but within 6 hours of leaving the hospital, they called back and said we were positive.
Okay. Well, I am so glad that you have made a full recovery. That must have been scary. Dr. Metcalf was talking about, these pre-existing conditions. In the lifestyle change program, you see a lot of pre-existing conditions. Would you talk a little bit about what you do in the program and, how important it is to address these pre-existing conditions and how you help the participants in the program actually overcome that to live healthy lives?
Absolutely. So our program, even though it is the CDC's National Diabetes Prevention Program, it is our version, the Black Women's Health Imperatives version of it. So we have made the cultural adaptations to make sure that the program is very effective for people of color in particular, and others, but in particular our people. And basically the program helps individuals to prevent diabetes by making lifestyle changes. It's based on an evidence on studies that prove that individuals that make lifestyle changes could prevent diabetes at greater rates than even taking metformin. But the lifestyle changes are necessary. Those lifestyle changes include getting healthy by losing typically 5 to 7% of their body weight or more, if necessary, and increasing their physical activity. Now, those sound like two really, to some people, very difficult changes to make. But in our program, we meet the participants where they are. Our program is led by lifestyle coaches that work with every individual and meets with them in groups to help them to adjust their lifestyles and make the tiny steps to get to those bigger steps and sustain it for the long haul. So we make sure that we never say you're not going to be able to eat this and you've got to go to a gym, because that's not necessary. We teach people how to make practical changes. We say, okay, if you love that corned beef sandwich, let's look at some healthy ways we can eat that corned beef sandwich. Like, let's not eat it every day. Let's look at some smoked turkey. Let's look at replacing some foods with some of the things that we cook with instead of deep frying. Let's try some different seasonings. And because our lifestyle coaches track what our participants are eating, because the participants meet in groups for 16 consecutive weeks. And then for the remainder of the year, they meet in groups twice a month. And then in those group sessions, they learn how to cook, how to move better, move more, cook better, and basically to make those lifestyle changes with the support of a lifestyle coach, and the group becomes a support group as well. So some of the things that Dr. Metcalf has already mentioned are the very things that we work on. We show people that you don't have to go to a gym. You don't have to have a Whole Foods in your community. We actually do shopping trips, grocery shopping trips, to say, okay, this is how you can eat well wherever you are. This is how you can shop well. This is how you can get the best deals. We even go to, we've taken groups to clubs here, where they might eat, because we have, Detroit, we've got our clubs and we always have some good food at our clubs. So we've actually shown them, yep, you can go to that club, you can eat this, tell them what you want on the menu, have them change it, but also get up and move. You don't have to go to the gym, but get up and do that hustle. Get up and do that, that ballroom dancing that we love so much here. Okay, so we just help people to adjust their lifestyle to increase their longevity in life and get healthy.
So wherever we are, there are things we can do.
Absolutely. And you don't want to tell people, look, we need you to get healthy, and that means you're going to have to flip a switch and change your life immediately. That's just not realistic. And it's not a diet program. It's not a diet program. We're saying make all these drastic changes for the short term so you can get into that dress or look good at that reunion. We're saying, how long do you want to be with your family? what kind of life do you want to live if you are here longer with your family? And we do that by example. We get our participants to help each other by coming in with ideas of what they want to do and how they did what they did. And we just celebrate everything we can. We create celebrations out of everything we can in these groups, just to make sure our participants stay engaged and stay encouraged.
And I might add, you have a very, very high success rate. So
yes,
that is something to celebrate as well.
Especially with the population that's hardest hit by these chronic diseases. The other thing we need to mention, Linda, is that we know, even though our program is a diabetes prevention program, we help participants prevent or manage chronic diseases such as hypertension, their asthma, kidney disease. We've had participants to come back and say, my doctor took me off my medication, or my doctor reduced my medication, and he wants to know what I'm doing. And we say, get him in here and let's talk, or let us talk to him so we can get him on board and he can send more. So it's a shame that we have so many incidents of this in our community, but at the same time, it's a good thing that we can help our community members and people at large to just do what is necessary to get healthy. It's not that difficult, and it takes help. It takes others helping you with those kinds of suggestions, and that's what we're about, and we look forward to doing even more of that.
Well, thank you, Paula. I see we've got a number of questions coming in. Again, if you have questions, please submit them. Stand by.
Okay.
I want to bring in our next guest, and I know there are a lot of questions. I know we're going to have some questions for you. So thank you.
Okay, thank you.
Our final guest for the day is Mrs. Michelle Lawrence Jawanda. I mentioned earlier, Michelle is currently at Google. And before that, she was Vice President for Legal Progress at the Center for American Progress, and has also worked with both state and national legislatures and other women's health organizations. So we're excited to have you here today. Michelle, how are you?
Hey, it's so good to see you, sis, and to join this conversation. It has been, I think, probably like most people, a really intense period. Unfortunately, similar to Paula, both of my parents came down with COVID-19, and my cousin, who actually lives with them. And that was a really scary period. I think I am a part of that generation, so I have parents who are aging, and then young children that you're trying to prepare for and care for. And so really feeling that at the same time, working full time, making the adjustment to being at home all the time and having a husband who's an elected official. So still very much on the front lines there. So it has been a moment without question.
So given all that, how are you juggling family, career, being in the public eye as much as you can, obviously with an elected official in the family, and I'll just ask, are you an expert homeschooler now?
I don't know if I'm an expert, but I've definitely picked up some tricks, like I'm sure what everybody else is doing. So one of the things that I have recognized is just this appreciation for your village that you don't necessarily even appreciate until you're in this moment. And so I had a great group of babysitters and church aunties and girlfriends who would help on pickup. And when all of that is really taken away, you really have to figure out, okay, how can I manage this situation? So very early on, we laid out a schedule. I have a 9-year-old, a 7-year-old, a 6-year-old, and a 15-month-old. I had to double check on that one. 3 girls and 1 boy. And at the same time, I'm managing our kind of U.S. partnerships and programs at Google policy. And so really thinking about what time can I give to work? And so really setting up a schedule so that in the mornings when most of my kids are doing distance learning, that I try to be as present as I can, sit down with kids on screens. One of my daughters is autistic. And so the challenge of being able to kind of dial into a class every single day is such a change from the accommodations she's used to. So like if they are adjusting and going through this, then I have to stand up and I have to figure out how I can change. And really being honest with my, executive leadership. Listen, I need my mornings. I can dial in at night. I can come back online because we're a global company. Time zones are crazy. So listen, so sometimes you have a conference call at 8, 9 at night. But I think really being honest about what I needed to both serve as a mom and then also to kind of do my responsibilities. And I think everyone is really trying to figure out that moment. And I tell everybody it's okay. The first few weeks were really challenging. You kind of get down on yourself. I'm failing at everything. And I think being really honest about that was really important for me. And it was a turning point actually in my mental and actually my physical health. Because I started to see those effects of what the stress was doing and went back to basics, journaling, making that time, scheduling, and all that has made a real difference for me.
Yeah. We, particularly Black women, feel like we've got to do it all.
Yeah.
We do a lot, but it sounds like you gave yourself permission to not have to do it all and do it all right now.
Right. And I'm still struggling with that. It just so happened my younger sister was who lives in Atlanta and is a beautiful artist down there. She was already planning on being here. And then the quarantine hit in Atlanta and she was like, well, I'm staying with you. I'm not going back there by myself. And it's just, she's been such a godsend for creating and getting those moments in the space that sometimes I just need to take 10 minutes to myself and not have somebody follow me into the bathroom. Very, very little things. And I think you appreciate it. But, we've had a lot of fun. I told somebody the other day, we made mud pies and we ran in the rain and we went on bicycles. And I haven't done any of that in years. And so it's also given me permission to do those things that I felt like maybe I was missing out. Because life, you learn and you get into the routine and you get into the work. And now having to adjust is making me appreciate some of these other things differently.
Well, thank you. I hope others are listening and will take that advice and employ some of those strategies. I want to ask a question as we bring Dr. Metcalf and Paula Greensmith back on camera for other questions. But you recently and bravely shared on social media that you have what we would call a preexisting condition. You were diagnosed with lupus, and obviously lupus has been in the news, particularly around a medication, hydroxychloroquine. But in acknowledging that, what have been some of your concerns about having lupus in the age of COVID-19?
It was really a scary period. I found out in January around my birthday. And one of the things that I immediately started to worry about was kind of longevity and what that means when I have very young children, and recognizing that while lupus is the overall condition, often people who have lupus, it is the kind of other things that end up having a real effect, whether it's kind of your proclivity to be more susceptible to cancer or different kind of organ issues. And so really having to take stock for the first time, really ever in life. I live a general healthy lifestyle. I'm out. I spend time really focusing on what I eat. And then I recognize that I have to really redouble my efforts because I don't plan on going nowhere anytime soon. But really dealing with fear, I think that's the first thing, coming to grips with that. And then when you see the medication that I just was able to acquire, that has made such a huge difference in my life to feel better, and just really the pain that I was in and the fear of not being able to access that during COVID was really a scary moment. But I will say, you know, there are blessings in the midst of this moment. My work community at Google over, overwhelmingly really wrapped their arms around me. My sister networks, strangers and friends on Twitter and Instagram. It was a really beautiful moment. People shared their own stories and what they had been going through. And so what I think I'm taking away in that moment is, one, I need to kind of better align with other people who are going through this process and learn more about the disease and recognize that I'm not alone. And there is actually a network of people who can provide great advice and expertise and care. And really happy that even in this moment, I'm finding that.
Well, I am happy too, and I'm happy you found medication that works. I see Paula, we have you back, and I think
Yes.
we're trying to get Dr. Metcalf back. But I want to ask a question that's come up. You know, you're in Detroit, and we've seen the statistics about the rate of infection and mortality from COVID-19 among Black Americans in Detroit. What is the community doing? How is the community responding to this?
That's interesting. As with everything with this, you know, we are seeing change every day. As I mentioned early on, I'm sorry, I'm hearing, is that feedback? Okay. As I mentioned early on, we went to a suburban hospital where we were tested and the test was available to us right away. However, we had to, of course, notify everyone we had been in contact with that we had tested positive, and some of the people we told about it went to hospitals and were not able to be tested. Now, remember, that was a little earlier on. That was in March. Now, their tests are available. About 1,000 tests are available at our state fairgrounds through the city of Detroit. But I'm sorry, 1,000 a day. And so that has made a big difference. However, you must have a prescription from your doctor to get that. So I'm not sure how that's affecting so many people that, can't get to a doctor or, can't reach their doctor. Our doctor just happens to be that kind of hands-on physician that calls you back and, calls to check and see how you're doing after he has told you what to do. So I just pray that that the individuals out here that really need the test can get it. We know of cases where there's a tragic story out there right now about a father and a son who had gone to 3 different hospitals, and they both died within a day of each other or something like that. But that story is trending everywhere because it's so tragic. That I'd like to think that it's gotten much better than that, though, in this last week. As late as last week, our doctor said we were supposed to go back and be tested. Then he said there aren't any tests available. And then he called us back and said, now you can go to the state fairgrounds and be tested. So things are just changing that rapidly.
Yes, very fluid situation.
Yes.
Dr. Metcalf, we have a question about diabetes. And the question is that the person says, I've heard of type 1 and type 2 diabetes. Are they the same? What's the difference?
Oh, they're different. Type 1 diabetes is usually an autoimmune condition, which means it occurs because of some type of insult. And type 1 diabetics are immediately placed on insulin. That means they are completely insulin resistant, which means they have to be placed on insulin, and no oral medications nor diet can help them. Their pancreas is stop functioning. Whereas type 2 diabetes is typically what comes on with more insulin resistance, obesity, and decline in the functioning of the pancreas. So type 2 diabetics is something that usually comes on with time, age, weight, and a decline in pancreatic function. And that's the one that we talk about can be prevented. Type 2 is typically the one that can be prevented and treated with diet and exercise, as you were speaking about a little bit earlier. And when you talked about the lifestyle changes where patients stop having to take glucophage, that's a perfect example of how lifestyle modifications help. And we have to think about obesity is such a big epidemic, and obesity it typically is almost the number one cause of illness and disease, and to the point where you see that insurance companies are putting weight loss surgery as the first option now. So when insurance companies will pay for something without giving you a hassle, we know that obesity is one of the, it's taking so much money out of these insurance companies' pockets that they're saying, hey, let's give them a weight loss surgery right now so we can prevent these complications down the road.
And so to be clear, Paula, in the lifestyle change program, and people are asking, what is CYO squared? It is focused on type 2 diabetes, not type 1 diabetes.
Absolutely.
Okay. And people can get information about the CYO squared program by going to bwhi.org. There's plenty of information there and can learn about it and even find out groups in your area. In the couple minutes that we have left, Michelle, you work for a really big organization. They kind of do data and technology. What are some of the thoughts or even programs or ideas that are going to be implemented to look at data to respond to COVID-19 to help the American public deal with it?
Well, one of the things we're really excited about, I think, one, we recognized early on that we have a responsibility and role to play. And I think private companies you're seeing across the board are stepping up. One of the first things that we announced is an $800 million grant that we're doing to help small businesses recover during this moment. And that's a combination of a number of different things. But one of the things that I'm really excited about is we're working with community opportunity development organizations and local communities who will help getting resources into communities that typically have challenges with the traditional banking system. So that's one really great thing. We're going to have to make sure that we do as much as we can to support our small businesses. In addition, we announced last week Apple and Google, two widely known companies, are moving forward on what's called exposure notification, or you might have heard the term contact tracing. And this is something that we're rolling out globally. And I'm sure Dr. Metcalf can speak to this, is understanding when you, as someone with COVID, has the disease, we're providing a API, which is the ability for phones to communicate without sharing any personal identifiable information, but to alert someone if you've been in the vicinity that I have had COVID and you are also at risk of, or you've been exposed to the disease. That's something that we're going to roll out globally. That's going to take a little bit of time to roll out, but we're really excited that, two big names are working together. We're doing a lot of work in supporting local journalists. So we announced a global fund to support journalism because one, our people die for the lack of knowledge. And so we recognize that supporting local news organizations during this time, getting the right information, making sure that misinformation, we've seen all types of horrible cures, and you can do this and it can up. And so we're doing a lot to stamp out misinformation online. If people have questions or concerns, you can just go to Google. Everybody knows how to use that. Go to Google/COVID-19, and we have a host of different resources, information that you can use, and that we're constantly iterating and updating daily.
Well, thank you. That contact tracing via data and GIS and tracking has been used successfully in other countries.
That's
and
right.
I know people are concerned about privacy, and so I'm glad that we're doing this. This is, as an epidemiologist, we talk about shoe leather epidemiology. This is shoe leather epidemiology. Find a case, find everybody they've been in contact with, get in touch with them. You can actually control the spread. So we'll be standing by for that for sure.
Thanks.
So I want to thank all of my panelists, Dr. Scott Metcalf, Paula Green-Smith, Michelle Lawrence Jawanda. Thank you so much for sharing your expertise, your experiences, your viewpoints on COVID-19, particularly related to underlying conditions. I'm so glad we could spend some time with you together, and I wish you all the best. Take care, keep to that schedule, and Paula, you keep feeling better.
Thank you.
Thank you very much.
Thank you.
Thank you, everybody. It's great to join you.
Thank you. So on behalf of the Black Women's Health Imperative, I want to thank you all for joining us. We have another episode obviously planned for next week where we're going to talk about some very sensitive issues around women and women's ability to meet their basic needs in the time of COVID-19. But this episode will be available on our website. I know we didn't get to all of the questions, but we will keep track of them and get answers. If you haven't done so already, take a moment to visit our website, coronavirus.bwhi.org. And there you'll find information and other resources to help you with this pandemic. And before we go, I just want to share a final thought. We've been talking a lot about bending the curve. So that means we get to the point where the rate of infections has slowed and we begin to see both infections and mortality rates drop. And of course, that's what we want to get to. Recently, in the news, a number of governors have talked about opening their states. I happen to live in Georgia, where the governor here has said we're going to open for business. The idea is, to kind of get back to normal. The concern I have is when you listen to sort of my colleagues in epidemiology, they talk about getting herd immunity. That's the point where we've got so much exposure that the rate of transmission really slows down. Well, some models show that we need to have 60 to 70% of people be exposed to COVID-19 before we get to that point. And frankly, as an epidemiologist, that scares me to no end. And I think about the communities that are hardest hit. So I appreciate that the governors need to open business. I'm not a small business owner, so I can't even imagine what the owner of a restaurant may feel right now, having had to lay off staff, not being able to make payroll. However, I happened to be out today and I saw hair salons opening and a couple of other businesses opening. This becomes an issue of businesses opening and spreading disease. I get in a nail salon, the idea is we'll have hand sanitizers, we'll put up the plexiglass dividers. All it takes is one sneeze from someone who has COVID-19. No amount of hand sanitizer or plexiglass is going to stop the spread of those droplets. And we've already seen data from a restaurant. One cough, one sneeze, 9 people get infected. So as hard as this is, we do need to maintain our policy of staying in, minimizing social contact, and being very thoughtful and sensitive to those who can't, those who are our first responders, and those people who cannot work from home, who have to get on buses, who have to face customers. They're the ones that need to be protected. So I just am encouraging all of my friends, my colleagues to do what we can, support local takeout businesses. One of the things that's concerning me also is with the unemployment rate, the food banks are running out of food and yet there's a greater need for food. Do what you can to provide food for those who find themselves unable to pay for food. Support your local food bank, support your local restaurants, make sure people have their basic necessities. We need to do this until this curve actually bends, until we can actually get back to work, until we can actually be with our family and friends. And as hard as it is, we need to do everything we can to stop the spread. So thank you for joining us today. Thank you for listening. Please join us next week where we'll talk about more of the impact of COVID-19. And for now, please be safe, stay at home, take care of your family and friends, check on people, and do everything you can to take care of yourselves. Thank you.